of the changes got. It was poor planning on my behalf. I apologize, but I'm here and we're gonna make the best of it, okay? So I usually for the review, I always focus on the test bank questions, but this year I kind of change it up just because always exam one is the hard one, right? And most people fail. So I wanted to do a little bit of something different that I've been doing with the past cohorts. And this time I look for other questions that I know they're going to be a little bit more difficult than what you are used to. But I think that if you are able to do these questions, the difficult ones, then I think you're going to have really good chances of getting a good grade on your exam. For those of you that attended the correct number of sessions, I'm going to give you the test bank, right? I'm going to give it to you. I always tell students, just make sure you do every single question. It's almost 100 questions that I have for you. Do them all. I don't know if they're going to be on the exam. I don't know which one will be on the exam because they always use the test bank. But I know that if you do every question that you sit to do the questions, I know you're going to pass the exam, okay? If you get it, you get it, right? So if you get an email, it's because you made the cut. That's basically how it works. You needed to attend half plus one, so whatever number of sessions. Today is one session, right? So either you attend in the morning or afternoon. I'm just counting it as one. That's correct. I'm pretty sure it was a total. Yes, I think we did 6 in total. So half plus one is 4. So if you get the email, that's it. If you didn't get the email, it's because you didn't attend a minimum of 4 sessions. Okay, so we're gonna start with the questions. If you cannot speak, you know what to do. Make sure you put the clock away. And if you are able to talk, please open the mic because that's going to make it faster for all of us. You read the question. You don't have to open the microphone for the to read the question. Just I don't know. I like to read the questions on my own. I don't like people reading me a question, so that's what I just tell me you're there. Turn off your mic, and when you're ready to answer, just answer the question. Okay, Abigail, you ready?
I'm ready.
Good, perfect.
Do I just answer when I'm ready?
Yes, that's correct. I'm waiting for you.
Would it be answer 4?
Can you say that again? I think it cut off.
Oh, sorry. Answer choice 4.
That's correct. And why is that?
That's the antidote for warfarin.
That's correct. So if they're giving us the INR, I know I'm talking about warfarin. With heparin, I don't worry about INR, right? Warfarin, I have to have a therapeutic range and a therapeutic INR, which is between 1 and 2. This is 5, so it means that it's too much. I have to give an antidote to my patient. Very good. And this is very likely, um, that's okay. I won't call your name. And this is very likely lots of questions on your exam because atrial fibrillation is not about atrial fibrillation. It's about giving the anticoagulant to my patient. That is my priority. I want you to remember that. Ada, you there?
Yes, I'm here.
Good. That one's yours.
is the answer choice 2?
That's correct. Very good. None of the other options have to do with shock. Remember, you need to know what are the three vital signs for any type of shock: tachycardia, tachypnea, and hypotension. Those are the three vital signs that you have to know. They are hinting shock. Now, number three, it's to confuse you: increase depth. It's not depth, it's rate of respirations. Actually, the depth is not as it's not as much, because you're breathing faster, so there's no way that you can do recoil completely. Very good, Ada. Amy, just tell me if you're there.
Yes, I'm here.
Good. And if anybody has a question, just jump in. If no, I'm assuming we're good. Hypotension, tachycardia, and tachypnea. You're welcome.
Is it 1?
No. Do you remember why do we use digoxin?
For blood pressure?
No. It's not to remove fluid. No, it's not to remove fluid. It's to lower the heart rate. Actually, technically, digoxin is not to do that, right? It's just to help with the contractions on the heart. But a side effect of digoxin is that it's gonna decrease the heart rate, right? It's a side effect. It's not the intended effect. So think about this. Who remembers what is the education on digoxin? Before you give digoxin, what do you have to do? You check the apical pulse for 1 full minute. And if it's less than 60, what do? You hold it, right? You don't give it. So here is where you need to make sure that your J1 and J2 are here. This exam is going to test all of it, right? So think about this. This is 48 beats per minute. He's already in bradycardia. If you give digoxin, you're just going to bottom this patient down. So that's why digoxin is not the correct answer, right? So, and this is why this semester is going to be difficult for you guys. All of the questions are going to bring topics from J1 and J2. That's why people fail this exam. So this is where you really need to pay attention. Now, let's talk about number 2. Can we defibrillate this patient? No, right? I already said bradycardia. We know we don't do bradycardia. Now, can you just continue and monitor the patient? No, because it's clearly telling you what? Complaints of dizziness, and look at that blood pressure. If I were to calculate the map, this patient is in shock already. If you calculate the map, this patient is already in shock. So this is not a patient to just watch and wait, right? So that gives you number 4, transcutaneous spasm, which we know is part of the algorithm in bradycardia, right? So this is how you need to tackle the options that the exam is going to give you. Go one by one and see if that intervention matches the dysrhythmia that they're giving you on the question, okay? So just remember that. Make sure you have your J1 and J2 because that's going to confuse you. Digoxin, the only job of digoxin there is to confuse. But remember that for the exam. Thank you very much, Amy. And don't worry, this is the place to learn. Alexa, you there? Okay, can you open the mic? It's not working. Okay, you can have this one. I'll pay attention to the chat. Why is that? And anybody can answer. Why is no oxygen, for example? Ah, very good, Kyle. Because we're thinking about pericarditis. And the key on this question is sharp pain with deep breathing. This is not myocardial infarction, okay? So if that's what you were thinking, they did what they wanted. They got you confused. Sharp chest pain with deep breathing is always pericarditis. So in order for me to confirm that I'm talking about pericarditis and not a myocardial infarction, my priority is going to be to listen because I'm going to listen to that pericardial friction, Rob. I'm going to listen for that, okay? I think somebody put something on the chat. Of course, but the patient is not telling you that he has chest pain. Do you see the difference? He's not telling me he has chest pain. He's having sharp chest pain with deep breathing, right? So I'm not thinking of a myocardial infarction. Sure, maybe down the road somebody says, let's just rule it out. Let's say you listen to the lungs and you don't listen for the pericardial friction, Rob, then sure, go ahead and get an ECG just to make sure. But they're not telling you this is a crushing chest pain because that's how they usually describe a myocardial infarction. Okay, good job. The next one is Aliana, Aliana Roach. Are you there?
Yes. Can you hear me?
Yeah, I can. That one's yours. Select all that apply. Just don't forget that.
Two and three.
And you're missing one.
Four.
With any of the cardiac dysrhythmias, we don't really think about the veins. This is more like a pumping issue, right? So we don't really think about the veins, especially because it's trying to pump out of the heart. That's the biggest issue. Anybody think, or you want to try again? That's correct. 1, 2, and 3. Now I want you to tell you guys, it's always the same for any dysrhythmia. They all have syncope, dizziness, and palpitations. Palpitations because there is an issue with contraction of the heart. We cannot pump blood. The heart gets crazy. And look at the heart rate, right? 100 beats, 150 beats per minute. That's like a lot of palpitations. Dizziness is because Again, your heart is working so hard. There's no proper cardiac output. You're going to feel the lack of oxygenation. And because of that, you feel like you're going to faint, right? So those three signs is good to remember. It goes for every single dysrhythmia, okay? Good job, Eliana. Alice, you there?
Hi. Yes, I'm
Okay,
here.
perfect. That one's yours.
Okay. Mm, I would say 3.
Are you sure?
um, I'm between 3 and
So let me tell you something.
okay.
Which of these signs
Mm-hmm.
the least terrible?
1,
The least?
2.
What do you think, guys? Which one is? So if you were to have a problem, which problem would you rather have? 3, right? So
Okay, yeah.
it is the correct answer that you gave me. And that's how you
Okay.
think about it. Because look, they're telling you which indicate that the procedure was effective. And you have
Mhm.
to think about, they have pericarditis, they're trying to avoid cardiac tamponade. I have to
Mhm.
pick a sign that is telling me that my patient is getting better and
Mhm.
not worse. Let's think about JVD. Is that a good thing to have? Hell no.
No, no.
You don't want a popping vein on your neck, right?
Right.
This, do you think dyspnea is a good thing to have? No, I wouldn't
No.
pick it, right? Now, muffled heart sounds, remember that is one of the cardiac tamponade triad because the
Mhm.
heart is sunk in water, so you can barely listen to the heart sound. So if my heart is drowning in water, I don't think that's good, right? So
Mhm.
if I have to pick one, I'd rather just have hypertension and that's
Okay.
it. I'm cool. Do you see? So that is
Mhm.
a way for you to kind of look at it. So all of them are bad, but which one is the least bad?
Mhm.
Okay?
Thank you.
You're welcome. And remember, pericardiocentesis is the procedure to remove the extra fluid from the pericardium because my problem is that from pericarditis, I can develop cardiac tamponade, which is basically a pool of water, and then you put your heart in that pool, and your heart is going to drown. Okay? Good. Thank you very much, Alice. Alisa, you there? Alisa Smith.
Yeah, I'm here.
Good.
Would it be 4?
Perfect. Yes. And remember, that's going to be a tricky thing on your exam. They want you to always say, defibrillate, defibrillate. No, you always have to, number one, check your patient. Number two, really, really confirm that the rhythm is correct because the paths can be misplayed. That it could be a lead that is not on the patient, right? There could be many things mimicking BFib. So before you go and shock your patient, make sure they don't have a pulse, make sure that they're not breathing, because all of those things are going to tell you, yes, this is BFib. With BFib, my patient doesn't have a pulse. So make sure you don't defibrillate somebody that is talking to you. The defibrillator has 3 buttons. One says sync, which is synchronized cardioversion. The other one says pacing, and the other one has a thunder, and the thunder is the defibrillation mode. So before you use, you have to click on the correct button. And trust me, so many people have shocked patients when they wanted to pace or they wanted to cardioverse. So you have to be very careful about that. But when you become nurses, everybody gets trained on the crash car because that's where you have the machine. So you will be trained on where to find the buttons and everything. No matter where you go, everybody gets trained on the crash car. Good. Very good job. So check, make sure it's B5 before you shock a patient. Ashley Hernandez, you there? Brandon, you there?
Yes, I am.
Go for it.
Okay, thank you. Okay. I know it's not 4 because that should be increased.
Okay, good job.
I don't think it's 1. Rising does. For some reason I think it's 3, but I'm not entirely sure.
So which one are you going to pick?
I'm gonna go for 3.
3. Anybody has something different to say? And I'm going to tell you something. 4 is not the right one, so you are correct about that. Anybody has any other idea? Where do we talk about pulses per doxis? Anybody remember? That's correct. Pericarditis and cardiac tamponade. So definitely not 1, right? So we know it's not 1 and it's not 4. Now, which one are you going to choose? And think about this. You are talking about a patient that had a myocardial infarction and now is developing cardiogenic shock. How is that card going to completely fail? By developing what? And maybe you already answered, it's just too fast. That's correct. By developing BFib. The most common thing that if it was a myocardial infarction that was not taken care appropriately, they start developing cardiogenic shock. By the time they get to the hospital, the body starts to shut down because the heart is not working, and there it's just gonna give up. And the best way to leave the scene is by doing a BFib. That is correct. So a ventricular dysrhythmia, that's usually. So remember that. And I don't know if you were with me last semester, when we talk about myocardial, so we talk about CAD, then we have hypertension, and then we have a myocardial infarction that develops into heart failure, and then cardiogenic shock is next, and then a ventricular dysrhythmia. That is kind of the evolution of the illness of the heart, okay? But good job, Brenda. Good. We have Kara. I know you're there. Right?
Yes, I'm here.
Good. That one's yours.
Because they don't see it on the electrocardiograph, I would say to just like check like the placements of it. And so I would go with 2. I'm sorry, 2.
That's correct. And again, this is something that is going to come to you on your exam because they want to make sure that you're not calling a code for everything. So yes, the correct answer is check the client status before you even do anything. Go and look at your patient. Is he passed out? Sure. Click on that blue button on the room. Start the whole code situation, right? But what if you go and he's just like eating cheesecake, So always check on your patient. Please remember that because these questions are going to try to trick you. That's what they want to do. Good job. Christian, you there?
Yeah, can you hear me?
Oh,
Yes, I'm
Christian.
here.
Christian. Good. Thank you, Christian.
Yes, I'm here.
That one's yours. You can take your time.
I'll choose one.
That's correct. Very good. So cardiogenic shock. It's not a cardiac tamponade because we don't have the pulses paradoxus, right? Which belongs to the Beck's triad. Deserting thoracic aortic aneurysm, the blood pressure will be like 0. That's just immediate death. A pulmonary embolism may be, but usually the blood pressure with a PE is a little bit higher. In this case, if you were to calculate your MAP, the MAP is really less than 65, and you can see that it's progressing towards hypotension, and that is kind of how the shock behaves. So because I know it's being progressively lower, then I can say that it is some type of shock for sure. Look at the tachycardia, look at the tachypnea. Those are the perfect signs of shock. And because I know it has to do with a myocardial infarction, I'm going to think about cardiogenic shock. Very good, Christine. Now, Christine, now it's your turn, and I know you're there.
Is it 3?
Yes, that's correct. So the QRS complexes that are Y, those are the tombstones. That's going to tell you VTAC. This is how the exam is going to ask about BTAC, BFIF, or AFib. So they can show you the strip, but they usually show you the strip and ask what is the appropriate intervention. But this is how they are going to ask this, the dysrhythmia. What is the rhythm, right? So make sure that in your mind, you can define each of the rhythms because that's how they're going to ask for it, okay? Very good. Good job. Emma, are you there?
Yep, I'm here.
Good.
Did the screen change or?
Oops. Yeah,
Okay.
you're right.
Thank you. Would it be 2?
So what are they asking you? They asking you a good thing or a bad thing?
A good thing.
A good thing, right? So you have to choose one that is a good thing for your patient. Because what they're telling you is like, look, you have to give them a shock. And how do I know the shock was good and it got them better?
So 1.
That's correct, right? If you look at them, you have number 3 that is arousable, but it still have bradycardia, and that blood pressure is terrible. Like anything less than 90 is a really crappy blood pressure. Now, number 4 is still on SVT. It's not conscious, and look at the blood pressure. It's great, right? You would think it's great. But a non-conscious patient with SVT can easily go to VTAC, right? And we have pulseless VTAC. So that's not that good. So if you think about the only one good for your patient is going to be 1, okay? Good job. Julia, you there?
Yes, I'm here.
Good. Go for it.
I would say 4.
Priority. If you think about it, all of that are correct. Like all of these are correct. But which one is priority?
2.
That's correct, right? So
Okay.
you got to make sure it's working before you send the patient away, right? So if the device is not working, you shouldn't be discharging them at all. Yes, you got to assess level of anxiety, because how easy is going to be this for the patient when they go home? Yes, they need an ID bracelet. Yes, they need to know about what are the restrictions. All of it is true, but which is your priority? That before you even send them away, it's working, right? So that's, remember, when they tell you priority, is that that is the most important thing over them all. And usually all of them are true. When you see a question that says priority, all of them are correct. Which one is the most important, right? Which one will kill your patient if you don't do? That's how you need to read them. Okay, now I want to show you an exercise. I want to show you an exercise that I have always done when I'm studying. And this is even before I was in nursing school. But when I was in your position, this is how I pass adult theory. When I think about a topic, and because this is nursing priorities, I will always go to the nursing diagnosis. And then we talk about shock, ineffective peripheral tissue perfusion. So I'm going to think about 3 nursing interventions that I get to do as a nurse in order to improve the outcome of my patient. So, Kat, are you there?
Yes.
So if your nursing diagnosis is an effective peripheral tissue perfusion, what 3 nursing interventions you are going to do, starting with the most important?
will administer oxygen.
That's your most important. Very good. What else?
I'm not sure.
Anybody wants to jump in? Fluids. Yes, fluids. Because why not, right? At this point, I don't know what is causing that, but I know that if I have fluid, I can improve circulation, right? Now, you got to be careful if they're asking you about cardiogenic shock, right? Probably fluids is not going to be the answer. So fluids, yes, that is an option, right? What else? Yes, vasopressors. And this is usually what we do at an ER ICU level, right? I'm going to do medications that help me with that. So norepinephrine, right? Dopamine, they're going to help me to make sure that every single part of the body is going to get a little bit of perfusion. See? That's how you think about it. Now, let's think about risk for ineffective GI perfusion. So I'm talking about specifically the GI. What are 3 things that you need to be thinking if that is your nursing diagnosis? And anybody can say that. Yes, but we're talking about nursing interventions. Remember, your exam is going to ask about nursing interventions. So what would you do to help your patient? For GI perfusion, blood transfusion for GI perfusion, remember, this is a specific to the GI. So I will be auscultating bowel sounds. That's correct, because that's going to give me a sense of what's going on. If I'm going towards paralytic ileus, which is something you already mentioned. So yes, so part of your intervention are going to be auscultating. Sure, I think that will be part of your head-to-toe assessment, right? But is that going to promote GI perfusion, or that's going to help you think about? Not really, right? I'm going to guess they're probably not going to be distended at all because they're dead. Like they're going towards dying. But what else? How do we keep these patients alive, right? So what's something? Sure, yes. Oxygen, all of them have oxygen. But remember, I'm asking about GI perfusion. But are you talking about the GI? Are these patients able to ambulate? Hell no, right? But how do I help them to not lose their bowels? A nasogastric, it's a good one, but what is the main thing? Sure, I'm going to be doing PPIs. All of these patients are going to be on PPIs. That is for sure. But how is the PPI helping the GI perfusion? How is the fiber helping the GI perfusion? How is palpation helping the GI perfusion? Do you see? But how? How? You're not saying it. Again, can these patients ambulate? Ask yourself, we're talking about shock. Can these patients ambulate? And how do you do that? Yes, you're right, but how do you do that? No one has said it. No. How do you avoid or do you help the bowels to stay alive? No. Think about this. You have a patient in ICU with a million things going on. And one of your concerns is the GI system. How do you help these patients to keep the GI system so when they recover, they actually have a GI system? That's what you are not thinking. Yes, nutrition, total parenteral nutrition, right? You are telling me things as this is a patient that it's a walkie-talkie. Is this a walkie-talkie? Is this a walkie-talkie? No, this is an ICU patient. So you have to think about what is an appropriate way. How am I going to be giving them laxatives? No, TPN is probably going to make them poop a lot. Why would you do that to your patient? Oh yeah, I'm going to feed them fiber through the endotracheal tube they have in the mouth. Good job. So you have to be thinking about your patient. And this is what I always tell you in the classes. Are you thinking about the patient? Who is the patient in front of you? Is a nice, obese patient with rosy cheeks that is talking to you? Or is this a bedbound patient with a million tubes in the ICU? Remember, this module, guys, all of these patients for you are in the ICU. None of them are on the floor. We don't do vasopressors on the floor, okay? So this is what I want you to think. But do you see how the exercise helps you? Because all of the answers that you gave me, the incorrect answers, are the answers you're gonna find on your exam, and you're gonna select the wrong. So always think about the patient you have and select the intervention that in the situation you have, it's gonna help. How do you keep the bowels alive? By making them work. So you have to think about total parenteral nutrition because this is a way to keep the bowels alive, okay? Do you see what I'm trying to show you? Okay. Do you have any questions for me? Anything? Anything that is burning your mouth? Anything that you don't know very well? And you can be honest. This is the place to not know. Yes, those are all appropriate interventions. That is correct, especially because if I'm going to start TPN, I have to be auscultating bowel sounds, right? Because if they're not bowel sounds, I need to be stopping that TPN, talking to the doctor, and be thinking about maybe a different type of nutrition. Yes, that's correct. And you can do this exercise. I have it for every single thing, right? So I have it for shock. I have it. I have it for all of them. I think I just have, it's down the road, but you can do this for any topic. And this is how you learn what are your priorities. What are my priorities as a nurse? And always think about the diagnosis. Yes, all of the things you said are correct, but always think about that diagnosis for my specific patient. And guys, I know it sounds silly, but it's not that bad. The questions is not that bad. Once you understand what is that they want from you, and they are only assessing if you can keep a patient alive. So the first thing to keep a patient alive is know your patient. What is in front of you? Because if you don't know what's in front of you, you're going to choose an intervention that is not appropriate. So try to tackle your questions like that and see if that helps you a little bit better. The NCLEX is exactly the same thing. They're going to give you options. 2 of them kill your patient. 1 keep them alive but not very well, and the other one saves your patient. That's all they're asking. They are testing if you can keep a patient alive, right? Whether you're going to be a good or bad nurse, that's just going to be determined when you become a nurse. And that's not what the NCLEX is trying to do. They just want to make sure that they're going to give you a license and that you can keep people alive. That's it. So try to see the questions in the same way, okay? Now, guys, a couple of things. I'm going to share the questions, of course, as soon as we sign off. For those of you that haven't met the number 4, if you come back to 9 and you hit the number 4, I will count it as a session just to kind of help you out. But I want to say something. I've noticed that a lot of people sign up to the sessions and that's it, right? They just leave it there. How do I know? Because the session is over, everybody leaves, and they are there. And then I say, do you have a question? Nobody answers. So I know they just sign in and left. That doesn't count as attendance. And I want you to know that. And I want you to know that I've been writing those names. I want you to know that I've been paying attention to that. So don't be surprised if you say, I attended every session, and then Lilo doesn't send the questions. Well, it's because everybody left, you didn't left, I talked to you, and nobody was there. So If you're coming to my sessions, I hope you're coming because you find something here that can help you pass the class. And that is not the test bank or the questions or anything I have to share, right? If you're just coming for that, don't come. Just Google it, because that's, well, I bought a couple of things, but you can find it on Google. Don't waste your time with me. Just don't come. If you are coming, it's because you think, or I hope you think, you can learn something from me. And I can help you be a good nurse. I'm not here to help you pass with an A, right? I want to help you to be a good nurse so you can apply the knowledge when you go to clinicals, when you become a nurse, because you're very close, guys. So I want to say that I understand some people work, and I understand that, sometimes you're at work and all you can do is listen, right? But you can use the chat to let me know that you're listening, right? But when you don't use the chat, everybody leaves and nobody's there. I know you're just signing on for the questions. Okay? So I want to throw that out there, and I want you to think about it, right? It might not be for you, right? So don't take it the wrong way if it's not for you, right? If you know you have been signing out and you're at work and you cannot talk, then this is not for you. But I'm just saying, think about it, right? Don't waste your time coming here for questions that you can pay for it. You can find it on Google, right? So make sure you're using these resources because you really want to use it, right? Because that's the whole point of me being here. Otherwise, I would be like, okay, just give me $5 and I'll send you all the things that I have. That's not the point, guys. That's not how you're gonna learn. And that's all I wanted to say. Okay. And if you have any questions and you have anything to say, you can email me, right? Like I said, I'm not speaking directly to anybody. I'm just throwing it out there so I know who comes and who doesn't come. That's what I want you to know, okay? If you don't have any questions, as soon as we finish, I'm gonna send the questions. Like I said, those of you that didn't achieve the number 4, if you come back tonight and tonight is your number 4, I will also share the questions with you, okay? If you wanna come back, okay? You can come back tonight. We're gonna do different questions and different exercises. So if you wanna come back, I will be here at 6 p.m., okay? Thank you very much. Thank you for listening. I appreciate that. I have thought about being a teacher